Hello to all of you. Today we will tell you about cervical cancer. Let's start. Cervical cancer is seen in the cells in the lower part of the uterus called the cervix, neck, and is one of the most common gynecological cancers in the world. It is the 14th most common cancer type among cancer types and ranks fourth in the most common cancer types detected in women. The cervix is the neck-shaped part of the uterus that connects to the vagina. Various strains of the human papillomavirus, HPV, which causes sexually transmitted infections, is the most common biological agent causing cervical cancer. In most women, when exposed to the virus, the immune system prevents the body from being damaged by the virus. However, in a small group of women, the virus survives for years. These viruses can start the process that causes some cells on the surface of the cervix to become cancer cells. What are the symptoms of cervical cancer? The most common symptom of cervical cancer is vaginal bleeding. Vaginal bleeding can be seen outside menstrual periods, after sexual intercourse, or in the postmenopausal period. Another common symptom is pain during sexual intercourse, which is defined as dyspareunia. Abnormal excessive vaginal discharge, abnormal disruption of the menstrual cycle are some of the early symptoms of cervical cancer. In advanced stages, anemia may develop due to abnormal vaginal bleeding and add to the disease picture. Persistent pain in the lower abdomen, legs, and back may accompany the symptoms. Due to the mass formed, obstruction in the urinary tract may occur and may cause problems such as pain during urination or frequent urination. As with other cancers, involuntary weight loss may accompany these symptoms. Urine or fecal leakage may occur due to new connections to the vagina. These connections between the bladder or large intestine and the vagina are called fistula. What are the symptoms of cervical cancer during pregnancy? Symptoms of cervical cancer during pregnancy are the same as before pregnancy. However, cervical cancer usually does not give symptoms in the early stages. Therefore, it is important to have regular gynecological examinations for early detection of cervical cancer. Symptoms of cervical cancer are as follows: vaginal bleeding, vaginal discharge, pelvic pain, urinary tract problems. If you are at risk of cervical cancer during pregnancy, you should consult your doctor. Cervical cancer vaccine. The cervical cancer vaccine is a vaccine that protects against cervical cancer caused by a virus called human papillomavirus, HPV. HPV is a sexually transmitted virus and causes various types of cancer and diseases such as genital warts, especially cervical cancer. The HPV vaccine, which provides serious protection against cervical cancer, has no upper age limit. From the age of 9, HPV vaccine can be applied to all women. What are the causes of cervical cancer? The causes of cervical cancer are mutations in the DNA of healthy cells in this region. Healthy cells divide in a certain cycle, continue their lives, and leave their place to young cells when the time comes. As a result of mutations, this cell cycle is disrupted and cells begin to multiply uncontrollably. Abnormal cell growth leads to the formation of structures called masses, or tumors. If these formations are malignant, such as aggressive growth and invasion of other surrounding and distant body structures, they are referred to as cancer. The human papillomavirus, HPV, is found in about 99% of cervical cancers. HPV is a sexually transmitted virus and causes genital warts. It spreads between individuals after skin contact during oral, vaginal, or anal sexual intercourse. There are more than 100 different types of HPV, many of which are considered low risk and do not cause cervical cancer. The number of HPV types found to be associated with cancer is 20. More than 75% of cervical cancer cases are caused by HPV-16 and HPV-18, which are often referred to as high-risk HPV types. High-risk HPV types can cause cervical cell abnormalities or cancer. However, HPV is not the only cause of cervical cancer. Most women with HPV do not develop cervical cancer. Some other risk factors, such as smoking, HIV infection, and age at first sexual intercourse, increase the likelihood of women exposed to HPV developing cervical cancer. In a person with a normally functioning immune system, HPV infection can be eliminated by the body itself within a period of approximately 2 years. Many people are looking for an answer to the question of whether cervical cancer spreads. Cervical cancer, like other types of cancer, can separate from the tumor and spread to different parts of the body. What are the types of cervical cancer? Knowing the type of cervical cancer helps your doctor decide which treatment you need. There are two main types of cervical cancer: squamous cell cancer and adenocarcinoma. These are named according to the type of cancerous cell. Squamous cells are flat, skin-like cells that cover the outer surface of the cervix. Between 70 and 80 out of every 100 cervical cancers are squamous cell cancers. Adenocarcinoma is a type of cancer that develops from column-shaped gland cells that produce mucus. Gland cells are scattered in the cervical canal. Adenocarcinoma is less common than squamous cell cancer. However, there has been an increase in the frequency of detection in recent years. More than 10% of women with cervical cancer have adenocarcinoma. The third most common type of cervical cancer is adenosquamous cancer and includes both cell types. Small cell cancers are less common. Apart from these, there are other rare types of cancer in the cervix. What are the risk factors for cervical cancer? There are many risk factors associated with cervical cancer. Human papillomavirus, HPV infection, is the most important risk factor for cervical cancer. Women who smoke have twice the risk of cervical cancer compared to non-smokers. In people with a weak immune system, the body is unable to destroy HPV infections and cancer cells. The HIV virus, or certain medications that impair immunity, increase the risk of cervical cancer because they weaken the body's defenses. According to some studies, the risk of cervical cancer was found to be higher in women whose blood tests and cervical mucus examination showed evidence of previous chlamydia infection. Women who do not consume enough fruit and vegetables in their diet may be at risk for cervical cancer. Overweight and obese women have a higher risk of developing adenocarcinoma of the cervix. A family history of cervical cancer is another risk factor. DES is a hormonal drug given to some women between 1940 and 1971 to prevent miscarriage. It was found that women whose mothers used DES while pregnant had a higher incidence of clear cell adenocarcinoma of the vagina or cervix than would normally be expected. What are the prevention methods for cervical cancer? More than 500,000 new cases of cervical cancer are detected every year all over the world. Approximately 250,000 of these women die every year due to this disease. Knowing one's susceptibility to any type of cancer can be cognitively and emotionally exhausting, but it is possible to reduce the risk of developing cancer with the right prevention methods in preventable cancers. Cervical cancer is one of the few cancers that is almost completely preventable. By avoiding the sexually transmitted human papillomavirus, a great deal of cancer prevention can be achieved. The basis of prevention is condom use and other barrier methods. There are vaccines developed against HPV types that are considered to be associated with cervical cancer. The vaccine is considered highly effective, especially if it is administered from the beginning of puberty until the 30s. Regardless of your age, it is recommended that you consult your physician and get information about HPV vaccine. A screening test called PEEP smear can be applied to prevent cervical cancer before it occurs. The PEEP smear test is an important test that detects the presence of cancerous cells in the cervix. During the procedure, the cells in this area are gently scraped and a sample is taken and then analyzed in the laboratory to search for abnormal cells. In this test, which, although a little uncomfortable, takes place in a very short time, the vaginal canal is opened by means of a speculum, and thus access to the cervix is facilitated. A cell sample is collected by scraping this area with medical instruments such as a brush or spatula. Apart from these, personal precautions such as avoiding smoking, eating a diet based on fruits and vegetables, and getting rid of excess weight, which increase the risk of cervical cancer, also reduce the risk of developing cervical cancer. How is cervical cancer diagnosed? Cervical cancer may not cause significant complaints in patients at the initial stage. The first stages of the diagnostic approach after application to physicians are taking the patient's medical history and performing a physical examination. Endocervical curettage. It is the process of taking a sample from the cervix using a spoon-shaped medical instrument called a curette and another brush-like instrument. If suspicious results are obtained in the samples taken with these procedures, further examinations can be applied. Cone biopsy. In this procedure, which is performed under general anesthesia, a small cone-shaped section is removed from the cervix and examined in the laboratory. In this procedure, cell samples can be taken from deeper parts of the cervix. If cervical cancer is detected after these examinations, staging of the disease can be performed with various radiological examinations. X-ray, computed tomography, CT, magnetic resonance imaging, MRI, and positron emission tomography, PET, are among the radiological examinations used for cervical cancer staging. Cervical cancer stages staging is based on the degree of spread of the cancer. Cervical cancer stages form the basis of treatment planning, and this disease has a total of 4 stages. Cervical cancer stages are divided into 4 as Stage 1, Stage 2, Stage 3, and Stage 4. Stage 1, cervical cancer. In Stage 1 cervical cancer, the growth is still small, but it may have spread to the surrounding lymph nodes. In this stage of cervical cancer, the disease cannot be detected in other parts of the body. Stage 2, cervical cancer. The cancerous tissue in the second stage of the disease is slightly larger than in the first stage of the disease. It may have spread outside the genitals and to the lymph nodes, but it is detected without further progression. The age of the patient's first sexual intercourse, whether the patient feels pain during sexual intercourse, and whether the patient complains of bleeding after intercourse are questioned. Other questions that need to be addressed include whether the patient has had a sexually transmitted disease before, the number of sexual partners, whether HPV or HIV has been detected in the patient before, tobacco use, and whether the patient has been vaccinated against HPV, menstrual cycle, and the development of abnormal bleeding during these periods. Physical examination is the examination of the external and internal parts of the genital structures of the person. The presence of suspicious lesions in the genital area examination is examined. Cervical screening test is pap smear cytology examination. Failure to detect abnormal cells in the examination following sample collection ensures that the result is interpreted as normal. Abnormal test results do not necessarily indicate that the person has cancer. Abnormal cells can be graded as a typical, mild, moderate, advanced, and carcinoma in situ. Carcinoma in situ (CIS) is a general term for an early stage of cancer. Cervical carcinoma in situ is defined as stage 0 cervical cancer. CIS is cancer that is found only on the surface of the cervix and has progressed deeper. If your doctor suspects cervical cancer or if abnormal cells are found in a cervical screening test, they will order a number of tests for further diagnosis. A colposcopy is an instrument that allows your doctor to take a closer look at the cervix. It is usually not painful, but you may feel pain if a biopsy is needed. Needle biopsy. A needle biopsy of the transition zone between cancer cells and normal cells may be necessary for diagnosis. Stage 3, cervical cancer. In this stage of cervical cancer, the disease is observed to spread to the lower parts of the vagina and outside the groin area. Depending on the progression, it may cause obstruction in the urinary tract, leaving the kidneys. Apart from these parts, there is no discomfort in other parts of the body. Stage 4, cervical cancer. It is the last stage of the disease when the disease leaves the genitals and spreads metastases to other organs such as lung, bone, and liver. What are the treatment methods for cervical cancer? The stage of cervical cancer is the most important factor in the choice of treatment. However, other factors such as the exact location of the cancer in the cervix, the type of cancer, age, your general health status, and whether you want to have children also affect the treatment options. The treatment of cervical cancer can be a single treatment or a combination of several treatment options. Surgery can be used to remove the cancer. Radiotherapy, chemotherapy, or radiochemotherapy, which is a combination of the two, are other treatment methods depending on the stage of the cancer and the patient's condition. The treatment approach in early stage cervical cancer is surgical interventions. The decision on which procedure to be performed depends on the size and stage of the cancer and whether the patient has a desire for pregnancy in the future. Removal of the cancerous area only. In very small cervical cancer patients, it may be possible to remove the structure by cone biopsy. Except for the cervix tissue, which is removed in the form of a cone, other cervix areas are not intervened. This surgical intervention may be preferred especially in women who want to become pregnant in the future, if the degree of their disease allows. Removal of the cervix, trachelectomy. The surgical procedure called radical trachelectomy refers to the removal of the cervix and some tissues surrounding this structure. After this procedure, which can be preferred in patients with early-stage cervical cancer, the person can become pregnant again in the future due to the lack of intervention in the uterus. Removal of the cervix and uterine tissue, hysterectomy. One of the preferred surgical methods for most patients with early-stage cervical cancer is hysterectomy. With this surgery, the patient's cervix uterus, and a region of the vagina as well as the surrounding lymph nodes are removed. With hysterectomy, the person can completely get rid of this disease and the chance of recurrence is eliminated, but it is impossible for the person to become pregnant in the postoperative period due to the removal of the reproductive organs. In addition to surgical interventions, radiation therapy, radiotherapy, using high-energy beams can be applied in some patients. Radiotherapy is usually used in combination with chemotherapy, especially in patients with advanced cervical cancer. In some patients, these treatment modalities can also be used to reduce the risk of recurrence if the disease is found to have a high likelihood of recurrence. After radiotherapy, the person may go into menopause following the treatment due to damage to the reproductive cell eggs. For this reason, women who wish to become pregnant in the future should discuss with their physician how to store their reproductive cells outside the body. Chemotherapy is a treatment aimed at eliminating cancer cells by means of powerful chemical drugs. Chemotherapy drugs can be given orally or intravenously. In advanced cancer cases, chemotherapy treatment applied in combination with radiotherapy can increase the effectiveness of the treatments applied. Apart from these procedures, various drugs can be used within the scope of targeted treatment by revealing various properties in cancer cells. It is a treatment method that can be applied together with chemotherapy in advanced cervical cancer patients. Apart from these treatments, drug treatment that strengthens the fight against cancer by stimulating the person's own immune system is called immunotherapy. Cancer cells can make themselves invisible to the immune system by means of various proteins they produce. Especially in advanced stages and in people who have not responded to other treatment methods, cancer cells can be detected and eliminated by the immune system with immunotherapy. In patients with cervical cancer detected in early stages, the 5-year survival rate is 92% after appropriate treatment. For this reason, if you notice symptoms of this disease, it is recommended that you seek support by contacting health institutions. How is cervical cancer test performed? Cervical cancer tests are tests to detect abnormal cell changes in the cervix or HPV infection at an early stage. Pap smear, Pap swab test, and HPV are the most commonly used screening tests. Frequently asked questions: at what age does cervical cancer occur? Cervical cancer usually occurs in the 30s and 40s. However, this is not a definite situation. This type of cancer can occur at any age. The high-risk period is considered to be the late 30s and early 60s. Cervical cancer is less common in young women, but in rare cases, it can also occur in teenagers. Can cervical cancer be treated? Cervical cancer is one of the types of cancer that can be treated. The treatment plan usually depends on the stage, size, location, and general health of the patient. Cervical cancer treatment includes surgery, radiotherapy, chemotherapy, or a combination of these. Does cervical cancer kill? Cervical cancer is a curable type of cancer when detected and treated in the early stages. Regular gynecological examinations and cervical cancer screening tests increase the chance of catching abnormal cell changes or cancer at an early stage. However, cervical cancer is a deadly form of cancer. What causes cervical cancer? The main cause of cervical cancer is an infection caused by a virus called human papillomavirus, HPV. HPV is a sexually transmitted virus. In some cases, the body can clear the HPV infection on its own and eliminate it without any symptoms. Thank you for watching.